to our third Lunch and Learn series um, with President Fowler and Melody Blake. And today it's Melody Blake's um, turn to host this meeting along with Sirena Fritz. I'll say hello to Allison Wilcox up there in Michigan. Hi, Allison. How are you? And welcome.
Thank you. Doing well. It got cold again, though.
I know, but we're glad that you're here. Today, we're going to talk about the nursing program and COVID-19. And for those of you who do not know, Melody Blake has been the provost at Wesleyan since 2017. And she also serves as vice president for academic affairs. She's responsible for strategic planning and development of academic programs and overseeing our world-class faculty, one of whom is our other presenter today, Sirena Fritz. Sirena, since 2010, Sirena served in the role of nursing program chair at Macon State College. She also worked as a cardiovascular clinical nurse specialist at the Medical Center and HCA Coliseum Hospital. Before the pandemic, she would take her nursing students to Jamaica for a week-long mission trip, and they really enjoyed that. She is our program director of the Bachelor of Science of Nursing program and associate professor of nursing, and she's been at Wesleyan since 2012. So I'm going to turn this over to Melody and Sirena, and we'll hear what they have to say, and there'll be time to ask them questions. And just want to say hello to Michelle. Thank you for joining in, Michelle. Good to see you. And Melody?
Well, good afternoon, everybody. And it's a pleasure to be here and to be able to talk with you a little bit about a topic that I know that I'm pretty much feel done with, COVID. And I'm rooting on that vaccine like no other, right? And the distribution of that thing across the world. But, you know, as we're going to stay our course until that vaccine is fully dispersed, and we're going to stay our course and stay healthy and keep our community healthy. But we're cheering them on. I've never really cheered on a drug company before, but now I feel quite much like I want to send them my good vibes. Sirena and I today are going to talk about COVID on campus, but then I asked Sirena to join me because she's really going to talk about how this is impacting our nursing program and what's going on in our nursing program. Because as you know, there are kind of, in some ways, our most vulnerable students because they're out in the community and in our hospitals. And so we thought you might find it interesting. We want this to be interactive. So really at any point you want to talk about something, we'll do that too. We have a PowerPoint, but we're not committed to it. If the conversation wants to veer in another direction, we'd much rather have that and have it be interactive. So I'm going to share my screen. Maybe, here we go. And get this going. And then again, but please feel free to jump in at any point with questions. And this is really Serena's doing to make this really quite beautiful PowerPoint presentation. So thank you for that. It's just so colorful. I'm gonna have to have her do all my presentations. Serena, did you want to start with this, or was I can't? So
and we can kind of just tag team it. So
okay.
Most of you know, as far as in Georgia in March, like with the rest of the country, Georgia experienced a shelter in place because of the pandemic, and want to acknowledge as far as that, as everybody knows, we had to quickly shift. All of our classes had to transition into a virtual and Zoom sessions. In nursing, what we decided to do is that we focused on our classroom transition first and gave the students a week or two to transition into that model before we focused on trying to do a virtual patient in the clinical setting. Also, in the same time in March, the provost created the task force. And I'm gonna stop right there for a second and let her explain, because that task force is still ongoing and has provided much of the guidance to the campus during this pandemic.
Sure, and thank you, Sirena. We've met weekly throughout this pandemic, starting back in March, and we've gone just this last couple of weeks to monthly. So because we're kind of getting tired of each other. But we have people from across campus. We have one of our nursing instructors, Dr. Roberts. We have our nurse practitioner who runs our clinic, Ashley Pullen, and they give us kind of the medical, feedback and input on any planning that we do. And then we have basically at the director level, most of our directors on how this is going to impact different parts of the campus. And the task force is advisory. We make recommendations to cabinet for any policies or changes that need to be made. It's been very helpful to have that as a feedback loop and as a creation and be able to, so we can give cabinet good recommendations for decision making, and also to make sure that we're thinking about the impact across campus. So when we, in academics, since that's the part that I most focus on, we think, well, we'll do X in our classrooms. Well, that really impacts our housekeeping staff, and it impacts our facility staff. And so having them in the room to kind of talk through how all of that work will be has been very helpful to us.
And so that task force has been instrumental in when we have problems or we have questions about our students or how we have to handle a situation, or if something, everybody can't think of everything, we can pitch it to the task force to the next time that they meet to see how that will impact campus. So getting back to our timeline, when we moved our nursing clinicals to a virtual online environment, so this was something that impacted us as well as other programs across the state. So what nursing departments did in schools across the state of Georgia is we went to weekly meetings where we met every Wednesday via Zoom on how we were going to transition these students, how they were still going to meet their objectives, what different people were choosing to do to help students to graduate, because all of a sudden we were all in a predicament where the patients that our students need to be able to have their clinical experiences on could have been the most infectious patients, and we needed to protect our students as well. So we were lucky in the fact that our seniors had already completed. And it was just pure luck, but so glad it was. We had a front loading of clinical experiences this past spring. So our seniors that were graduating had already completed all of their hospital clinical. They do community clinical as far as with community outreach and hospice, and those aspects haven't been completed at that time, but we were able to move those to a virtual environment. And what an online clinical looks like is that there's certain programs and things that we can purchase, and the students have avatars, and they are an avatar, much like a little bit like a gaming system with a patient, and they can click for their avatar to say different things. Their patient responds with different comments depending on if it's appropriate or not, or sometimes they can, make comments like, "Did you wash your hands?" And so the avatar does automatic with the faculty are there to monitor how they were doing and to look at their progress and how they go through their assessment and their questions. So we moved through that. We also had to move all of our standardized testing to a remote proctored environment, which was challenging in a short period of time, again, but with everybody else in the country doing the same situation. And as a college, we had a virtual honors day via Zoom in April. So various things that, just think about this. If we'd ask anybody to what a Zoom meeting was like back in December, most of us were not been very aware or even have experienced maybe one or two of those before then. As a campus in May, we did a virtual baccalaureate. And then the summer, we realized that we survived spring, and survive being the key word in that, in academics, but we needed to make a different plan for the fall going forward. And what was the best model for that? Melody, you want to talk about our hybrid model and how it worked across campus?
Sure. So we decided to develop a hybrid model, or to adopt a hybrid model, and what they're calling in academia a high flex hybrid model. And so, new words came up. Through a pandemic, we learned the high flex We decided to do it before we knew it had a name. But so hybrid meant that if it was a Monday, Wednesday, Friday class, instead of meeting, like Monday, Wednesday, Friday for 50 minutes, that half of that time where we were kind of going to say 50 minutes of that week instruction, a student would do on their own. So they would do that independently. And then the class would only meet then. It would meet in person on one of those days, and it would meet via Zoom on the other day. So of the 3 days, one in person, one via Zoom, and then one where the student was learning independently. And that's how we define hybrid. You can define it lots of different ways, but that was Leslie. On a Tuesday, Thursday class, they'd meet in person one day, and then the student would work independently on the other day on work. So this has worked for us, but I'm about ready to talk to the faculty about spring and about some tweaks we might need to do it, because the students are reporting that it's a lot of extra work. So that, because when a student comes to class on Monday, Wednesday, Friday, to be honest, most of the time she may or might not be prepared for that class. She might have read and she might have, been prepared, or she might not have, depending upon her schedule. But when she has to work independently, she actually has to complete some assignments for that time. So she's required to do those assignments. Well, that's not her homework. That's her class time. So now she has her homework on top of that. In her mind, she just got double work. And so the faculty and I are gonna kind of brainstorm and talk about that for spring to see if we want to tweak it. But so that's kind of how we did a lot of faculty training on that. We had a lot of faculty training over the summer on what that means, how you do that, how you help our students be successful. And then I see there we had a room task force created, because we took all of our rooms and we're only using about a third of them. And then we socially distanced those rooms and moved furniture around and taped off the front of the room, and then moved all of our classes into those rooms, which required us to change class times. And it was quite the it was quite the spreadsheet. It was a colorful spreadsheet by the time we were done.
And now we've moved into August, into fall, and our classes have resumed. Like I said, we've learned some lessons. We're doing testing, isolation, and quarantine protocols were established since our students are now back on campus. That's run through our student health department. Ashley Pullen is able to do that. And now we have rapid testing available here on campus. So that does help us tremendously as far as to be able to screen our students if we need to, or if we have students that are exposed to other students that have tested positive, and that allows us to be able to control the spread on campus. The biggest message that we were able to share with the faculty and what the task force and for national messaging as well, as far as socially distance by maintaining 6 feet, wear a face mask, sanitize and wash your hands, and stay home. This has been a constant theme. There's signs all over campus. If we could take you on a tour of campus, we could show you there are signs everywhere, in every room, coming into every building, to remind students of this. We also there are electronic thermometers that it's almost like now we don't even hear them, but before initially you would hear these beeps every time somebody walked into the building, because it's scanning everyone's temperatures to let them know if they didn't take their temperature before they left home, which we're encouraging them to do, that just before when they first step into the building, that's there. But this is something that, again, for students that have been sitting in class, to remind them, and I think our students have transitioned well. The nursing students have an interesting aspect on this, as far as when they're in clinical in the hospital. We wear a mask either for 8 to 12 hours, depending on how long they're there. We purposely do not put them in COVID areas because of the extra PPE because PPE was in short supply, to be able to provide that. And the students can learn their clinical experiences without having to be exposed to that purposely, but obviously indirectly. There are patients that come into the hospital that are asymptomatic, or that come in for a knee replacement that we don't know they're having COVID symptoms until a day or two after they've been admitted to the hospital. So this has been a little bit of a challenge to try to make sure that we're tracking them and trying to keep it in close communication with the hospital, because we're only in the hospital, a group is only there 1 day a week, and the patient testing results for COVID might not be back that day. They might have been tested after the student leaves. So a lot of coordination to try to figure this aspect out. But we have our cases in the nursing department, as far as COVID cases, have been really maintained to other aspects, community spread versus spread from people being exposed to COVID in the hospital. So we're very proud of that an aspect. That was a little bit about clinical. Let's talk about some things in the classroom. On your right is just a picture of the Golden Heart classroom. And you can see the signs that are on the desk, and the sign tells the students not to sit in that space. As far as that previously that room had a capacity of 24 students. And so tables were moved and chairs were removed out of that room to reduce that down to about 11. So that has been, we've had to think about how we do our clinicals, because if for those of y'all that have been on campus and have toured the area in the nursing department, the Golden Heart classroom is where previously we had taught some of our classes. We can't now because of social distancing in that room class size, but our clinicals overflow into that classroom. So we've had to be purposeful now in assigning specific times that students can be on campus for a clinical, and so that they're not all here, or not even a small portion of them are here at any one given time. Another great intervention on the left is the owl. We've jokingly called him Hootie in the nursing department. I don't know what other people call him on campus, but we nicknamed him Hootie. And Hootie is a device that will, it sits on a perch or a stand at the front of the classroom, and it allows what it talks about as far as the 360 video feature and audio. So a student, if you have a student that's in quarantine, they're not feeling bad, maybe they've just been exposed to someone else, and so we want to protect the pack and keep them at home, they do not have to miss out on their classroom experience during this time. And this is not just for nursing, this is all over campus. We have Hooties or owls in the classrooms. But he has a unique feature. If a student talks in the classroom, one of his cameras will focus on that student talking. And then if another student talks, he will adjust his camera to pick up the other student, and it shows up on the screen, on the Zoom screen. He also has a camera that shows a panoramic view of the classroom for a student that is joining the classroom via Zoom, and can show the instructor. So students can, if we were conducting a classroom right now with the owl, you could ask us questions and it would project over the owl. And so you really would feel like that you were just sitting in a different room, but you were participating with the classroom experience the same as everyone else. Melody, do you have anything that you want to add about him?
No, we have found him to be he's worked. It's not perfect. You can't always hear, it depends on the room. A couple of them broke down, needed to go to the infirmary. The owls need to go to their owl infirmary. We've had a lot of fun, using owl words about them, but in general, it has been really a great, and we have them. We have actually 27 on campus right now, maybe 30. And I imagine that they won't go away. I imagine there'll be something that we use, because students will get, once we get out of this COVID world, they'll get sick for other reasons, right? And need to, isolate or stay at home, and I hope that one of our lessons learned will be to not, in the past, it was this stoic, go to work even if you're sick, come to school even if you're sick. I kind of think that might go away, and we might be more inclined to tell people stay away if you're sick because we don't want your germs. And so I think the owl could be something that could be very useful moving forward.
Nursing has definitely found him helpful in trying to bridge that gap with students that are isolated or quarantined. An additional thing that we've done in the nursing when they come to labs is we individually screen our students before they're allowed. We've treated our lab as a clean zone, if you will, as much as possible. So before they're actually allowed to walk in there, their temperatures are checked. They're asked a series of questions. And this is done each and every time they walk into that lab. They have to wash their hands when they go into the lab. We've removed everything that is what we call a multi-use item. Or if it's something that we couldn't remove and it's multi-use, then there are cleaning stations and wipes beside it. All of the sheets and the pillowcases and the bed coverings have been removed in our nursing lab because that's not something that's easily cleaned between each person. So all of our mannequins have on now paper gowns, and we go through a lot of paper gowns because we change them between each student coming in, and the bed is cleaned between each student. So even if we have set up in the lab, we have 3 beds in our lab. If we have 3 stations set up and the student is moving from station to station, then they have to clean that bed and a new gown placed on before the next student comes behind them. So it is with every single time they go through, it is immense cleaning of the surfaces, again, particularly in our lab, to keep that learning space as clean as we possibly can make it, because that's the one single area that all of our students go through. So we realized that that was going to be at a higher risk. I want to stop right here and see, we've been going through for a minute. What about questions or comments or anything about some of the things we've talked about so far?
Well, I wondered in the lab, do all of you wear disposable gloves?
We do wear gloves, and in addition to everybody obviously has their mask that they wear when we go into the lab. We also wear face shields. We wear mask and face shields when we're in the lab, and so do the students. Everyone that goes into the lab has to wear mask and face shield. And the rationale beside that is because that it's hard to teach someone a skill on a patient and maintain a 6-foot social distance. So we do both mask and face shield since we are closer than 6 feet with people during that time.
We gave each of our faculty a smile mask. Here's one, so you can see they could teach with the mask where you could see the mouth. People don't love them. I guess they can steam up and they kind of weirdly can get stuck to your face. But they do use it if we have any student who has an accommodation for hearing, then the faculty are asked to wear it. If they don't have a student who has an accommodation for hearing, then I think a lot of the faculty have chosen not to wear them because of the discomfort of them, but it has worked really well for our hard of hearing students who need to see the lips. So,
Sirena, what is the most compelling reason that the college says to students for wearing masks and doing the social distancing? What is the most compelling reason or reasons, since nationally we don't seem to be doing a very good job?
I think for our nursing students, it's the fact that they want to be in class and they want to be able to continue to go to clinical in the hospital. So their motivation is they want to graduate on time. They don't want to have clinicals delayed. And so from my standpoint in our department, they've been fairly compliant. I mean, every now and then in the beginning, we had to, remind them that, but I guess because in the hospital, you don't walk through the doors. I mean, it's not up for negotiation. And they're just used to that mindset of these are the rules and you have to follow them. So we're in a little different situation, I think.
But Beverly, we had the task force talked hours over how are we going to get people to wear a mask, especially when, the federal or state government aren't requiring them and there's controversy over them, and how we're going to enforce that on campus. We have not found that to be problematic. We have not found that at all to be problematic. People, I mean, every once in a while, someone gets their mask under their nose, and we have to say, put it up, put it up higher. But we've had no discipline around masks.
Wonderful.
Now, I
Okay.
would like to say, as an observer of the students, and they're very conscientious. And I think those the mask program with the alums making all those 1,400 masks for students really helped to make them realize there are sisters out there who are encouraging us to stay healthy, and they are. And if you don't have a mask as a staff member, you might just be chided by one of our students. I mean, I really feel they are very conscientious, and they
are.
say, mask. I mean, more than any other students, and they're not really going out to bars and doing all kinds of stuff like that either. So that's good in a way,
A national model right there.
I think they
campus.
are. I mean, I really think they are.
I have a question for either Sirena or Melody. Has COVID impacted the application and acceptance of incoming nursing students?
That's a great question. As of right now, coming in because we are accepting applications now for our fall cohort that will start in August of 2021. We have more applicants to date than we have had in past cycles.
Wow,
So
great.
now, whether that's, I should give some shout outs to our admissions team, because they have been working hard, and we've been doing virtual recruiting sessions, which has been interesting to get on with high school students and do virtual sessions, but that's what every other college is doing as well. So the students are adjusting. So whether it's just students looking for job security when a pandemic and having nursing and healthcare being more in the news, or a combination of both, I'm not sure we'll know, but yes.
Okay, that's great. Thank you.
Other questions? So one thing I mentioned that we've done a good job, I feel like, as far as COVID on our campus. We have a total of what's reported on our COVID dashboard, and there's a link there that takes you to, there's a dashboard on the website that is updated daily that will show people what our COVID numbers are and how many cases we have reported for the day. And so our total confirmed cases on campus, and those are students, whether residential or whether non-residential students. So that's total reported cases is 27 since we started to be able to keep track. And so it is low. We're very proud of that number, especially when you consider that other universities in the Middle Georgia area have had hundreds of cases that are also residential campuses, that ours is so low. I don't know if there's anything else, Melody, you want to talk about that?
Yeah, and that's faculty and staff also.
Yeah.
So it's 27 reported cases among our community. But we also have probably put into quarantine over 90 students now who have had an active exposure to COVID. And in that, they have to stay there for 2 weeks. They're about 90 residential students have had to, at some point, have had an active exposure, and they don't leave their room for 2 weeks. We deliver them meals. We deliver them kind of some fun packs of things, activities to do. We've kind of taken up collections of giving them things to do. They attend their classes remotely. It's hard. That's hard. They do. We have somebody contact them daily. We stay in contact with them to make sure they're okay. Their mental health is okay. They're got what they want. Christy Henry is amazing. you know, they'll say, what I really, really need is a moon pie. And she'll go and get it for them, you know, apparently, you know, I mean, she really tries to take care of them while they're in quarantine. Of those, 5 then developed COVID. So there's lots of controversy about whether, and we're going to talk today as a COVID task force, are we being too cautious? Are we being just the right amount of cautious, right? You know, by keeping them, so 5 of them ended up turning out to be positive. So that means that 85 people had a really lousy 2 weeks for no reason. But you know, but how do you know? And so we're gonna grapple with that even this afternoon on whether that's what's the right approach. So.
And we do have some students that choose to quarantine at home, depending on where they're from.
Yeah.
They're given that choice.
We encourage that.
Yes, we encourage that.
Go let your mom take care of you. We like that. But a number of them don't want that option because they'd be going home to people who are vulnerable, you know, and so they want to protect their family. When we honor that.
But in the case that we do have a positive student case, the student is isolated. Again, they can continue classes on the OWL. The faculty are notified, and the rooms and common spaces are clean. So as far as there's a protocol that's initiated, that they have special cleaning that comes in for the classrooms that the students might have been exposed to during that day. If it's their dorm room, their suite mates might be relocated. There's a whole process between Provost Blake and Student Affairs to make sure that those areas and those things transpire. And I think that's worked out well. So our plan for the spring. So even if the rooting for the vaccines and for to come as soon as possible, we all know realistically, even when we have one, and then the fact of having an effective one and having it distributed to everyone are 2 different things. And so for spring, for nursing, we have realized that the fall, our students don't do well with some of the indirect days, like Melody was talking about, where they're given lots of homework to do or activities to do on their own. That hasn't worked as well for our students. Sometimes they don't do all those activities, and faculty are banging on the fact that they're doing them, and they move forward to the next thing when they're in person. So what we're electing to do is make those days Zoom sessions. So that way it still keeps the students off campus and also reduces the faculty's exposure to students, but it still keeps that accountability, that time to cover that content. Because we're in a particular situation with the program that you can't say, oh, well, if we just didn't cover, you know, these 5 sessions, if they just didn't get that material, well, then you just didn't cover that organ system and it'll be okay. So we can't not still meet our goals for each course.
You don't really need the heart, do you, Sirena?
Yeah, if you didn't cover that. Clinicals, our plan is still to press forward with in-hospital clinicals. The hospital does have the right, and they, you know, they can turn a unit into a COVID unit at any time, which means that our clinicals would be disruptive. So we have a backup plan if we have to go move a certain group or a certain cohort back to virtual clinicals. But our plan is to continue in-hospital clinicals as much as possible for the spring. Questions?
Michelle, you're on mute.
Sorry,
That's okay.
trying for you not to hear dogs versus me. I have a few questions that might not directly be related to the nursing program that some of the alumni have asked me to ask or to bring to the table today. A lot of it has to do with these sessions as a whole, so I'm just going to ask them or just put it out there for consideration. But one thing about these sessions was that they're lunch and learns, and that's really difficult for a lot of alumni when they have a lot of kids at home who are virtual, or people who are trying to work a job are having a hard time doing, and we're wondering if there was any consideration to nighttime or weekend offerings. I know you are recording the session, but it's something that was concerning some of them. Another thing is there seem to be quite a few alumni who have no idea that these sessions are happening or taking place. And my advice was to contact the alumni office, Kathy, and get with you guys and find out if their contact information is correct. But in addition, they're wondering if maybe you thought about starting like a text message type program to be able to text updates to the alumni about sessions like this, to kind of reach out to more people who maybe don't check their email or aren't going to the Wesleyan website.
Yeah, we we have the list of the upcoming events, and our next one, and I hope you all will join us, is on Wednesday, December 9th, when President Fowler and the athletic director and head softball coach Penny Siqueiros will talk about athletics at Wesleyan. We always send out the mass emails. We promote it on Facebook and on the website, and we send out an initial the initial list, and then we send out at least 2 follow-up ones for that. And we have considered, we've heard that a lot about lunch. This summer we had events, and we tried them at numerous times, at lunchtime, at 5:30. We even tried them at 7:30. We found, and maybe it's because people are back to work now, that lunchtime is less, it's kind of a hassle for them to do that, which is why we are recording. So they will be able to see this. You can tell them they will be able to see this on our website, and that's a really great feature. The 5:30 time space worked pretty good during the summer as well, but then people were telling me, oh no, especially a group in Florida said, oh no, that's when we have most of our staff meetings after work. So it's really hard to find a time that's great for everyone. But with the recording, I think that if they have email, that would be great. We haven't started texting yet. And I'll bring that up with data services to see if that's, an additional way we can promote these events. But I think communications is doing pretty good. But I mean, I don't check some of my email all the time either, so they may miss the messages. But they're out there in different forms. If they're on the Wesleyan website, if they're on the Facebook page, if they're looking at their email. So they're getting e-blasts in a number of ways. The texting part is something we should look at and consider. And a lot of us get messages via text, and some people like it, some people don't. So I love that they're thinking and offering suggestions about ways where they can be involved and we can get the word out. So thank you for sharing that.
No problem. I have one more.
Yeah.
Someone IM'd me this one and didn't want to say who their name was, but they want to know if there's anything that you can tell us from the nursing program, anything you can tell us as the alumni about that nursing student issue that came up this year that wasn't made in the public statement. Is there any, or are you just legally bound to what was released publicly? Like, is there any additional information you can give alumni to like set their mind a little bit more at ease than what they just saw from the communication?
Yeah, and when things become legal, then the college, our hands get a little tied about how we talk about legal matters. And so I'm sure I can hear the lawyer's voice and, yapping in my ear right now saying, there's really nothing to say.
Okay, that's what I'll tell them. I'll respond with that. No problem.
I do know that just kind of internally, we're working really hard to make Wesleyan a diverse and an inclusive environment for all of our students. And so we are working and continuing to try to improve. Every organization can improve, right? And so obviously, and we just recently had a conversation diversity and inclusion conversation with our students just a couple nights ago. And there was about 15 that participated, mostly seniors. And they said, this year is a lot better than it has been. We see improvements being made. So that was a little bit encouraging on just an internal, that they're feeling, they reported that they're feeling that that there's more inclusion on campus than that they have felt in the past. And so that was a very encouraging finding. You know, obviously it was only 15 students, but they're there to really delve in and give feedback on our diversity inclusion efforts. And so that was a moment I thought that we could at least celebrate and could keep going, right? Don't stop, but just keep going. And so, but just sometimes to take a moment and celebrate when you get some good news is also a good thing to do. And so I was encouraged that we're at least starting to do the right things, you know.
Thank you.
Does anyone have other questions for Melody or Sirena?
Yes. Maybe a technical question, Sirena. What we're hearing about Pfizer's research indicates that, and they're very careful in the way they word this, it's more than 90% effective. Now, that could be anywhere from 90.1 to 99 or 100, but I suspect it's close to 90%. So that's probably going to be as good as it gets for that company and that particular vaccine they're working on. In other words, they're not going to add another chemical agent to it to boost it. Okay. So if that becomes one of many that really can't be 100%, and chances are that'll never happen anywhere with any kind of drug. So if that's as good as it gets, will the Wesleyan campus, or will there be a push to get students to become vaccinated, to require that? Could you talk a little bit about any thinking that might be underway with regard to vaccine and being vaccinated?
I think that's something that the COVID task force would take up and consider. And before they can do that, everything about the vaccines have to be more distributed and well known. So there's several different types of vaccines out there. Most of the ones now that are in developmental stage are a 2-part vaccine that has to be given. Some of them as far as even, a month apart, and it takes you 2 months to develop immunity. So I think there's still a lot unknown yet for even the college to start considering what would be their stance on vaccination or non-vaccinating or where we would go with that. So I think it's a great question and something definitely for us to ponder. But I don't know that we have enough information yet to start to go down that route.
I can tell you what we have done, though, is that we have applied to be a vaccination spot. And if we could, we don't know if we will be chosen. I mean, there's lots of criteria for who could get chosen. And if we could be a place where people could come to get vaccine, we've talked about using Porterhouse for that purpose, because it's, off campus, so you're not bringing people onto the campus, but close to the campus. What that would do would be able to get, if we could, right, it would make easy access for our students, faculty, and staff to get vaccinated. I don't know that we've talked about requiring, we haven't had those conversations yet, but if we could get access, right, quick, easy, students could walk over, we think we could see a much higher participation in a vaccine. So we haven't heard yet if we will be selected as a site, but that was our first step, is to say, well, let's get them here. And then that will, that will be easier. So we'll see what happens.
Thank you. Thank you.
I want to thank all of you for joining us today, and I hope you've learned a lot. I did, from Melody and Sirena. Want to thank Lisa Slobin for helping us record this so we can put it out on the website. We promised that we would be good stewards of your time, so we're going to end our meeting. And again, Wednesday, December 9th is the next Lunch and Learn that takes place with President Fowler and our athletic director. So I hope you have a good rest of the day. If any of you have any other questions, please email me and I'll pass them on to Melody and Sirena. Thank you all so much. Bye-bye.
Thank you, Kathy.
Bye.
Good to
Great.
see everybody.